How prepared is the Philippines to weather the entry of a more transmissible strain of COVID-19? That big question and more with Health Department Undersecretary Leopoldo Vega. Usec Vega, welcome once again to the big story, sir.
Good evening, Robbie, and good evening to everyone listening.
Usec, what do we know, what don't we know about this Omicron XE variant?
Yeah, first of all, it is a very new genotype variant, possibly of COVID of Omicron. And definitely it has been reported that it's going to be transmissible, but less infectious. And most of the people having this variant, especially in Thailand, have remained asymptomatic. So these are the few things that we've known about this variant. So we hope that this is going to be less lethal compared with the Delta. And of course, although it might be more transmissible, but we can also affect our public health standards in terms of the transmission.
Can we keep it out of the country? And for that matter, what might its impact be heading into the elections?
We can, but I'm sure everybody knows that the best measure and intervention really is our public health intervention, which is the minimal public health standards, and that's the use of our best fitted mask. And then you isolate once you have the symptoms with you. And definitely, if you need to have a vaccination for a booster or completing the primary dose, you should have it. And definitely, lastly, would be the airway, or wherein it has to be very good in terms of air exchange. So I think these are the very good public health interventions. And whether the COVID-19 is there, we can still minimize our individual risk.
Yes, but you mentioned the vaccination, you mentioned the boosters. We know that government is also trying to convince more people to get vaccinated. What's happening on that front?
Yeah, I think right after December and January, when we had the peak of the most people being vaccinated, and there was slowly a gradual non-transmission of the virus because of definitely the Omicron. Once Omicron came into the picture, there was less people getting infected because of the vaccination and because of the infection that went on. And of course, the complacency that happened, people were just satisfied with what they have. And therefore, we need to ramp up the vaccination more, especially now that there are new variants coming in. And meaning to say that we need to come up with better strategies really for improving the vaccination of the citizens around, and not just doing it in vaccination centers, but really going out into the different houses and rural areas and identify them through the local government units. In fact, there is also an issue right now whether to do the mandatory vaccination, because we know that the A1, A2, A3, and A4, there is still a substantial number of booster doses being given. And that's only about 12 million of the population.
Okay, maraming salamat po. That was DOH Undersecretary Leopoldo Vega. Following the easing of COVID-19 restrictions, the Philippines has been seeing a steady rise in tourist arrivals. Since allowing the entry of all vaccinated foreign tourists last April 1, international arrivals have been picking up. Foreign tourists now comprise almost 30% of arrivals, with the Immigration Bureau expecting arrivals to exceed 14,000 daily this month. The DOT is seeking the return of Korean tourists to boost arrivals as well. South Korea was the country's top market pre-pandemic, but has since been taken over by the US and Australia due to the surge in COVID cases in South Korea. But even with eased restrictions, DOT says travel requirements in the Philippines will be among the safest and most relaxed in Asia. The agency also assures that government instituted measures to ensure the safety of the public.